Hi everybody and welcome to today's webinar. This is our first webinar after our summer break. So welcome back everybody, or welcome to anyone who's a new viewer. I'm Anna from the TUC and I'm joined today by my colleagues Wilf Sullivan and Quinn Roache, who will be the main presenters today, and we'll be handing over to them in just a second. Just a bit of housekeeping before we get going. You'll see on the right hand side of the screen there's a chat panel. My colleagues will be posting links and resources there throughout the webinar, but please also use it to chat to each other, to introduce yourselves and to exchange ideas. Underneath us there's an ask a question panel. You can post any questions there for Quinn and for Wilf, and we'll do our best to answer as many as we can after the presentation. So if you've got a question, please post it there. You'll see also there's a big green button that says watch with live transcript. If you click that, this webinar will open in another window with captions, with live captions. But if you do that, please make sure you close this first window, otherwise you'll get an echo. We are also recording the webinar today, so if you have any technical issues or you've got to leave early, don't worry, because you'll be able to watch the recording back afterwards. So today's webinar is about the issue of the year, really, the impact of COVID-19, but with particular focus of the impact on Black workers and LGBT plus workers. So my colleague Wilf will be talking about the particular issues that affect our Black colleagues, and Quinn will be talking about the impact of COVID on LGBT plus and what things you as a union rep need to look out for in the workplace if you've got colleagues from these groups. So that's enough from me for now. I'm going to hand over to Quinn to get going with the first bit of.
Crap. Oh, sorry.
Yep, sorry. Over to you. Over to you.
Sorry, everybody. Accidentally, I thought I closed the window, and I thought that I just signed out, and I'm incredibly embarrassed. You might have just heard me curse. Please excuse me.
We're all okay.
Okay, great. Thank you. Okay, I'm a little flustered. Okay, I'm going to come back in. All right, so as Anna said, what I'm going to be talking to you today is about the impact of COVID-19 on LGBT plus people. And I'm going to try and break it down into what's happening outside of the workplace and what we're being told, what's happening inside the workplace, and what reps can do to really help LGBT people as we move from pandemic into recession. So what we're really concerned about and what our members have been telling us is that there's been a real impact on LGBT people's mental health. And this has been for a number of reasons, but one of the main reasons is that they have been forcibly distanced from their supportive community structures, and then had to face lockdown with people who have been hostile or discriminatory. And that includes particularly for young people who have had little option because of lack of savings, but to move back in with parents or families who are prejudiced or otherwise do not accept their identity. We also know that this moving back and being in one place has had a real impact, not only because of discriminatory family members, but it has meant that people have been unable to get away from hostile neighbors as well. So this kind of thing has been happening, which is really impacting on the mental health of LGBT people. We've also had organizations from within that community tell us that they've seen a real upsurge in contact to their helplines for domestic abuse and violence. So the LGBT Foundation reported a 30% increase in calls to their helpline about domestic violence. And what we know is that domestic violence is an issue LGBT people face. It's not really talked about, and that when they do, there isn't a lot of support structures available for them. So these things have all kind of upsurged during the pandemic. But also, when we've been speaking to our members and when we've been speaking to other unions about what's happening, what they've been telling us is that members have seen an increase in LGBT phobia from both customers and clients. And this has been true of key workers, And what members have said is it's explicitly true for those LGBT plus people who are visibly LGBT plus. And that, of course, is having a negative impact on their mental health. So there's something happening during this pandemic which has kind of woken some of the things LGBT people experience, but it's just become more prevalent in terms of hate crime and bullying and harassment. We also know that LGBT workers are at particular risk of redundancy because they're overrepresented in sectors of the economy where it's easier to be out. But those sectors are also the ones which are most likely to be hit by the recession. So arts and culture, travel and tourism, hospitality. So to say LGBT people are going to be disproportionately impacted by the recession and redundancies when they come up. So given the high rates of bullying and harassment pre-pandemic, now what we're seeing is those increasing during the pandemic and as we go into recession. Now, sorry, yeah, great. One of the most common complaints LGBT people have pre-recession was about bullying. So 4 in 10 LGBT people reported being bullied and harassed in the workplace. Yet only a third of those respondents reported the incident to their employer. We also know that about 3 in 10 said that the person doing the bullying was a manager. So really, as we go forward, it's vitally important reps and members are able to speak openly to address poor workplace culture. So, and that's why it's vital. So one of the things we're hoping reps will continue to do is to negotiate with employers to ensure the workplace as a whole is supportive of LGBT plus people. And that involves kind of negotiating with employers to ensure their policies, their equality policies are explicitly inclusive of trans workers and non-binary workers as well as LGBT. Ensuring that equality training is mandatory for all staff and rolled out, and that they take employers take a zero tolerance approach. And what would really help is for reps to be kind of pushing for these things to be explicit and to be making sure that third parties are captured. So one of the things we know is that it's not just kind of coworkers that can cause problems, but often it is third parties like customers, clients, and patients. So what we want is employers' policies to explicitly cover those scenarios. And this will very much depend on what sector and who you work with. But we know one of the risk factors for bullying and harassment from a third party is exposure to alcohol. So it's just about making sure those policies are clear. Also, what we know, being that kind of bullying and harassment is on the increase for LGBT people, is that means that more LGBT people will be experiencing sexual harassment. So about 2 years ago, the TUC did the first poll of its kind, and we found that 7 in 10 LGBT workers had experienced sexual harassment. What we also found out was that LGBT people didn't have the language to talk about their experiences. So it would be great if reps could start helping to provide that language. So, examples of behaviors that constitute sexual harassment for LGBT people are things like indecent or suggestive remarks, such as intercourse with someone of the opposite sex will make you straight. These are kind of things that we got told a lot of. So it's being able to kind of, going forward, protect people and give them the language they need to describe their experiences accurately. And the other thing I would say is, there's something about being an LGBT plus ally that is constant and always needed. And kind of the steps that one takes to do that are usually kind of really simple things like educate yourself, challenge phobia when you see it, and don't always rely on LGBT workers to do it themselves. It gets quite tiring if you're always having to stand up for your rights when other people are witnessing it. Make sure that you include LGBT workers in discussions and events. As I said, a lot of them have been isolated with people who are phobic and unapproving of who they are. So now is a great time to involve them in discussions, bring them in, talk to them, and that will really help with their mental health. And again, just kind of the basics around being an ally are listening to the issues that LGBT people raise and respecting their boundaries. And I think this is a thing that we hear a lot about, is that people ask inappropriate questions about LGBT people's sex lives, or if they're trans, how they're transitioning, and those things aren't necessarily appropriate. So just kind of helping to just think before you speak. But I guess if I have one piece of advice for reps, it's about kind of educating yourself and supporting your LGBT colleagues. They're the ones who are going through these issues and can really help advise on what the key ones are.
Thanks, Quinn. There's some really great advice there for reps and really good practical steps that they can take. If anyone has got any questions that they would like Quinn to expand on from what he's already started with, please post them either in the Ask a Question panel. I think what was really useful there, Quinn, is about, as we say with all workplace reps, is listen to your colleagues, listen to what they say, and be there as a source of support. Okay, Quinn, we'll come back to you shortly, and I'll apologise now as well. I think it was my mistake at the beginning. I muted myself too early, and that's why we had a little bit of confusion, but no harm done. But that was great. So I'm going to hand over now to Wilf. Wilf Sullivan will be telling us about risk assessments in the workplace, and specifically with risk assessments in the context of BME colleagues. We've all seen over the summer how the BME community has been disproportionately affected by COVID-19. So this is, I think, a really important area that workplace reps can get involved. So Wilf, over to you.
Thanks, Anna. Yeah, as Anna just said, and it's been a big part of the public debate about the way that black workers have been disproportionately affected by the pandemic. And at the TUC, one of the things that we've highlighted is that this is partly because of racism in the workplace and structural inequality in the labour market, and factors such as the kinds of jobs that people are working in terms of frontline jobs, the lack of job security, the lack of a social security safety net for many of those people from communities who are migrants, have no recourse to public funds, and the hostile environment policy have all had their part to play. And we laid that out in the report Dying on the Job, where there's a link to there. I think it's put a link up to that as part of this webinar. But one of the results of that has been this great debate about black workers being more at risk of dying because of COVID. And I think one of the things that TUC has been working hard to point out is that race is not a factor. Poverty is, and the way that people are forced to work. And that is especially important in the fact that people have not been properly protected at work. So one of the things that we saw from the Dying in the report, where we asked people to tell us their experiences, was people talking about a lack of PPE, a lack of basic protective measures, no consideration of people's travel arrangements, etc., etc., etc. I think one of the things that's happened in response to that is because people have focused on the medical conditions, that what employers are doing are saying where they are doing risk assessments, and we know that many aren't. I think it's the last survey that TUC done said only about 40% of employers were carrying out risk assessments. But when it comes to black workers, they focus on health issues. And this is really problematic. Yes, of course, people need to make an assessment as to what risk people are having in relation to COVID-19, but that's really easy to do. And on the NHS websites, there's a couple of lists of people that are clinically vulnerable or moderate risk, and ones that are extremely clinically vulnerable, and what those conditions are. And what the NHS has said right from the start, that those people who are at moderate risk can go to work, but they should still socially distance. But it also follows that employers should be taking steps to make sure that they're safe at work. So one of the problems that we've seen is that actually people putting in place what they call risk assessments, which one of the more popular ones out there I know is a sort of traffic light system where people, have to say what their medical conditions are, and then they get checked against a list, and they either get green, amber, or red. I'm not quite clear what it is employers are saying that they're going to do if somebody's red, but still, that's what they're doing. We think this is dangerous, actually. We've already heard of incidences where people either haven't got jobs or are being selected for redundancy if it's seen that they're at high risk, because actually, a typical employer response to reduce the risk is actually not employ the risky person or get rid of them. But we don't think it's about the person. Risk assessments are supposed to be about jobs and actually lessening the risk in the job. And one of the things that's been put up in the chat is a sort of supplementary document I put together to go with the TUC's and other guidance around risk assessments about what people should be thinking about. I think one of the things that employers don't often do is to do the basics around risk assessments in the way they think about them anyway, i.e. in terms of identifying what the hazards are, who might be harmed and how, what action that they need to take to control the risks, and who should carry out this action, and what are the deadlines. And I think, from a trade union point of view, those are the things that we should be seeking to negotiate. Because our risk assessments are too often, in my experience, not just at the TUC, but when I was a regional official, employers do some kind of tick box exercise. We go down, we've got a form, we make up answers to what the risks are, don't talk to anybody, don't talk to the workers, and then it just gets handed down. We've done this risk assessment and we're just showing it to you. In my view, that isn't a risk assessment, and as trade unionists we should make sure that that isn't a process that gets adopted when people carry out risk assessments. It should be negotiated. They should make sure that people are talked to, that workers are talked to, that are actually doing the jobs and know what the risks are, and then actually come up with a list of measures that they're taking to counter and minimise those risks. Because after all, that's the point of a risk assessment. The point of a risk assessment isn't just to identify risks, but it's also to identify actions that you're going to take to minimise that risk. And that means both making sure that workers have the opportunity, because after all, they are normally the best people to know how the job is organised, to come up with suggestions, as well as union reps coming up with suggestions as well, and trying to seek agreement about what those actions are going to be, when they're going to be carried out, and who's responsible for that. In terms of some of the things that are put in the document about the risks that need to be assessed, they're fairly simple, and they should apply to everybody anyway. It's about not placing black workers disproportionately in the front line, providing proper PPE, making sure the working environment is clean and safe, making sure there's proper social distancing, making sure everybody knows what the rules are in relation to social distancing, and to provide guidance to staff. I'm not going to go through it all, but there's some very basic things. One thing I haven't put in the list, which is covered in other areas, obviously as well, it's about travel. And that's an important aspect for black communities, because often whole communities and rely on public transport. And so, we need to be having a discussion with employers about what travel arrangements are, trying to make sure that people aren't travelling at times when actually it's risky, because there's so many people travelling that they're going to be a higher exposure to the environment. I'm not going to say much more, but what I will say is this: that as reps, I think, clearly members are looking at us to come up with solutions to protect them. They're in an environment, especially when people are in jobs on insecure contracts with low pay, where they're doing shift work, where there's a lot of agency work in the place and a lot of insecurity. People are feeling particularly vulnerable. But I think for us, this is actually an organising opportunity. It's an opportunity to engage with people, to have a real conversation about not only the risks that they face, but what it is they think needs to change in the workplace to minimise those risks, to make them feel safer, and then to get out there and actually negotiate those things with the employers. Because if we are successful at doing that, then actually it really demonstrates how important trade unions are and what we can do actually to materially affect people's lives in the workplace.
Absolutely. Thanks, Wilf. Yeah, and as always, talk to members, find out what members think, and use it as an organising opportunity to show the value and strength of unions. We've had some great questions come in, which I'll move to in just a second. There's a couple of comments in the chat I wanted to highlight. Not sure if you are keeping an eye on them, but Quinn, Herma Hughes a few minutes ago says thank you for highlighting the experiences of the LGBT plus community, and they say it's all about educating others in the community so that we can be humans to one another, which I think is a really great point. It's about being humans to one another, no matter what group, really. And yeah, great to see the comment that's just come in right at the bottom saying really useful stuff and plenty of notes taken already. Great to hear that you're taking notes, Rob. Yeah, and if you wanted to add even more detail to your notes, remember there's a recording that will be available. Right, so let's have a look at some of the questions that have come in. Right, so first one is for Quinn. Question comes from Peter, and Peter asks, what's the best way to encourage branches to support local LGBTQ plus and or, sorry, just 1 second, it's just moved, and or BME organisations, but I'll send this question to Quinn first, to mark LGBTQ History Month in February. Quinn, have you got any thoughts on that? Ways that within the branch that this event could be marked?
Well, I think LGBT History Month is a great month and a great event to mark. And just to say that we as trade unionists have a long, solid, strong history of supporting LGBT plus rights. And I'll just give you a bit of history and then I'll answer the question. But I think the first all-out strike happened in like 1974. In support of a gay colleague who had been dismissed. So, we do have a long and proud history of doing this. I think there are a number of resources you can get from LGBT plus history website that can help you to promote it internally. I think you should talk to the other members of your union at your workplace, and usually you have notice boards where you can put information up. So just try and get an agreement. I don't see why there wouldn't be, and then make it happen, because I think it's such an important thing to celebrate.
Thanks, Quinn. So same question to Wilf, but with regards to Black History Month in October.
I think it's Black History Month is as well as looking at history, to actually have an opportunity to discuss with Black members in your branch what their experiences are as well. And I think it's a matter of saying to Black members in your branch, giving them an opportunity to come up with ideas about what the branch could be doing, looking what other organisations in your local area are doing, and working out how you can work with them. Because there's a lot of stuff that goes on around Black History Month that's run by community organisations, that's run by local authorities, often which we could get involved in, but often we don't. One of the things that I think is really important in terms of getting involved with that is looking at the history and encouraging people to look at the history of what's happened here, especially in the world of work and trade unions, because You know, right from the beginning of the British trade union movement, there have been black activists that have played important roles in sort of advancing the cause of trade unionism in the UK, and we don't talk about that often enough.
Absolutely.
Can I just add in something I thought Wilf was definitely going to say, but actually every month should be LGBT plus History Month, and every month should be Black History Month. You don't have to refine and restrict that to that 1 month. But absolutely, I agree with everything Wilf said.
Sure. Thank you both for that. Okay, next question is just for you, Quinn. We've been asked, my union does not currently have an LGBT rep. Am I still able to go to them for LGBT specific support? What kind of support can I request from them if I am struggling in a phobic industry?
Yes, you should go to them. Absolutely. You don't need to go to an LGBT specific rep. You should be able to get the same assistance from any rep, and they should be able to support you. And if they don't have the language, they should be able to learn it. And also, just to say, there are a lot of free resources that we have at the TUC that you can access in case you want to look at them, or that your reps can access. But you should definitely go to your rep and they will support you, because that is what they're there to do.
Yeah, absolutely. Ian has just posted some links to some resources, perfectly timed, to match what Quinn was saying. Okay, so next question. I think this one will be for you, Wilf, because it relates to the risk assessment element of what we've been talking about, where someone asked, Bess asks, are you saying that employers responsible for ensuring that travel to work is reasonable and safe during the current pandemic?
We insist to employers that they take that into account as part of their workplace risk assessment. I've seen all kinds of organisations, employers putting in place, social distancing in the office, right? But then forgetting actually that their workers have to get there. I mean, and that's absolutely, there's absolutely no point minimising people's risk to the virus in the office environment. Actually, if people are going to catch COVID on the way to work and then spread it in the office, because that's the reality. Risk assessments have to be holistic, so they have to look at all aspects of that, and that has to be part of the discussion, because otherwise the arrangements that they're making in the office are just undermined by the fact that people are in a high risk environment in getting there. So we have to insist that they think about that, about whether it's about giving people the flexibility to travel in times of day when there's not so many people on public transport, whether it's having agreements. And certainly many years ago when I was branch secretary, we were trying to get people out of cars, negotiated an agreement with the local authority where actually they gave loans for people to be able to buy bikes at cheap interest rates. There's all kinds of things that we can get in there and negotiate and say, in terms of facilitating that travel to work in a safer way. But we have to insist that that's part of the discussion, because otherwise they'll forget about it. And I suspect many employers are just looking at how far they can space the desks, what signs they have to put on the floor, and forget that actually it's not about that. It's about people and how you keep them safe. I'll stop there.
Oh, it's excellent stuff, Wilf. So it's about having as broad an interpretation of what can be negotiated as possible, and nothing really is off the table if it's an option. Another quick question about risk assessments. Mike has asked if anybody has done risk assessments for BAME people as of yet in office and manufacturing locations. They've not received any replies on the question panel, but Wilf, do we know at the TUC if we've got evidence of any risk assessments in these locations for BME, or is it something we could find out?
Well, it's really problematic. I mean, I've been doing some work with one of my colleagues in international around distribution centres, meat processing factories, food processing plants, which are sort of the modern day factories, really. And clearly what's happening in risk assessments, workplace risk assessments aren't being done. And I think I understand why, because I started off as a factory worker myself, that actually that means that you have to change the way that you organise production, and that hits the bottom line. And a lot of what we don't do nowadays actually is talk about very much about how the workplace is organised. And so I think a lot of employers in big workplaces are very reluctant to get into that discussion, because social distancing, if you're working on a production line, social distancing has big implications for the amount of products that come off the line. If you're having to space workers out, it means there's less workers on the production line, et cetera, et cetera. And so they'd prefer to get into a risk assessment where they risk assess the person rather than the work. What we've seen a lot of, especially in really highly exploitative situations, is employers who, because employees are agency workers or they're on fixed term contracts, or they're casualised in many ways, that actually employers don't see that they have a responsibility for them. They're like this disposable labour. And if people get found to have COVID, it's like get rid of them, get the next one in. But ironically, those are the kinds of workplaces, and we've seen it, especially in the Midlands and in the Northwest, where there's high instances of COVID on the shop floor. Now, I mean, I don't think that's impossible to tackle. I was talking to a colleague in Usdaw who was done some organising around one of the meat processing factories in the Manchester area, where in fact the union his union official wasn't allowed on the premises, but was very successful in sort of organising people and getting the local reps to take up the issues and force the employers in that situation to get high quality PPE, more than just face masks, in order to protect people on the job. Because actually people want, if employers, one of the potential solutions is if employers feel that they can't do the 2 metre or metre and a half social, spacing, that actually one response is to say, right, okay, what you have to have is high quality PPE. And it's not like that hasn't happened in other countries. We look at people in China or Korea, and the road sweepers are running around in virtual hazmat suits. Here people just given a mask. And we have to say, well, hang on, that's not good enough. And this particular environment means that you have to have a much higher level and standard of PPE, because there's lots of people in this environment. Often environments where we have to consider things like the building, the airflow, what the air conditioning is doing, etc., where you have to take account. One last thing I was going to say, because I used to do a lot of stuff around what people called sick building syndrome. That one of the real good things to do in relation to doing risk assessments is to say to the company, let's see your sickness records. Do an analysis of your sickness records, right? Forget about COVID for a moment, right? And if there's a high level of respiratory diseases, reported cases of sickness in that workplace, right, then you've got a problem anyway, right? Because if people are getting coughs and colds and flus a lot in that workplace, then there's clearly something wrong with the way that the building's set up, either in terms of its airflow, air conditioning, the way that the air circulates around the building, which means that people catch germs. And therefore, it's going to be a disaster in relation to COVID. So it's not just about the working. Sometimes it's not just about the way the work's organised, but about the building itself and the building infrastructure as well. But one of the things about checking the building infrastructure is about checking the kinds of sicknesses that people get in a building. And if there is a certain kind, and you know there's a problem with the building, and you can say to the employer, look, this needs to be addressed. It needs to be investigated and addressed.
That's brilliant, Wilf. Thank you. Some really helpful information there. I've got a question for Quinn. So we've been speaking a lot about risk assessments, which naturally has been a big feature of reps' activities over the previous few months. And are there, even though Wilf's been focusing quite a lot on the physical things to do with risk assessments and physical health, are there any things that reps can look out for with regard to LGBT plus colleagues with risk assessments? And I'm thinking more specifically with regards to mental health and physical health. Have you got anything that we could add to that?
Well, I was actually just thinking about risk assessments as well, and thinking about risks of bullying and harassment and sexual harassment. And actually what we want employers to do is take kind of a risk-based approach to that as well, because we know there are certain things which enhance the risk of these behaviors being perpetrated. And so I wanted to kind of let anyone know on this call, if they're thinking about risks of bullying and harassment and a risk assessment, they can start thinking about including things like power imbalances and job insecurity and lone working. These all kind of heighten the risk of harassment, and particularly sexual harassment. As I said earlier, presence of alcohol in the event or on the premises, being customer facing, that also enhances your risk of bullying and harassment. So it's just these kinds of things. If you want to take a risk-based approach and you want to advise your employer to look at the risks and how they mitigate them, those are some of the things you'd want to pull out and advise them to have in their risk assessment. And then as a result, think about what they can do to mitigate them. Does that kind of help answer your question?
It does, yeah. That's great. Thank you, Quinn. I mean, obviously, risk assessment is a huge area. There are resources on the TUC website that may be helpful for everyone. We've also got a little piece of short e-learning that focuses on risk assessments as well, but that's about risk assessments in the general context. Obviously, we're adding to them here with some more specific detail. Right, let's have a look at what other questions that have come in. Just one moment. We've had comments from people about that even though traveling outside of the rush hour is good advice, it might not always be possible. But so I think this just emphasizes the point that it's about having all options on the table, really, and being creative and thinking of other ways where the same issue can be managed. Right, let's have a look at what else we've got. So I can't remember who it was. I think it might have been you, Wilf. Someone mentioned third parties earlier in the context of, no, sorry, I think it was you, Quinn, when we were talking about harassment from third parties. And someone's asked whether that includes students in an FE or an HE situation, or perhaps you can tell us a little bit more about what you meant by third parties in general.
Yeah, so I think students would be captured by that. When we talk about third parties, we're talking about clients, customers, patients, students, anyone who's not, or contractors, for example, anyone who's not directly employed by your organization. And employers should be thinking about how they mitigate third-party harassment. It's actually something that we've called for a number of times. And I'm not sure if this will be interesting to anyone, but the Equality and Human Rights Commission have produced some really good guidance on how to prevent harassment and sexual harassment in the workplace. It's technical guidance. They did that in consultation with trade unions, and we think it's really solid and really gives a good foundation of things employers should be looking to address and mitigate. So if you're really interested in this, that would be a great place to kind of look, because it's very explicit and gives detailed examples of what employers can do. But yeah, I think third parties, students would be included in that.
Thank you, Quinn. That's really helpful, and also helpful just to know what that broad definition of third parties mean, because I think it isn't always clear. We've had a question which actually sort of tinges on another equality area, but we could perhaps just very briefly think about it. This relates to, my colleague Ian has posted in the chat about the second in our series of equalities webinars, which is next week, where we'll be focusing on the impact of COVID-19 on women workers and on disabled workers. But we have had a question which sort of touches on this area. So I'm wondering whether we should just see if we've got a few words about it. We've been asked if we think ableism can also be a motivation for job losses or early redundancy when health conditions are disclosed by workers. And this specifically relates to the traffic light risk assessment that you mentioned, Wilf. So Quinn, I don't want to take away from obviously what you're going to talk about next week, because Quinn will be back, but perhaps we can just talk about it just in relation to risk assessments and health conditions. So Wilf?
Yeah, I mean, I think it's extremely problematic. And as I said, I've already had instances where people have phoned me up and told me about situations, both in relation to appointments for jobs and in relation to redundancies as well, where when those risk assessments that have been done on that basis of people's just purely on the basis of people's health, and what's seen as a risk in terms of their health, then they either haven't been appointed or they haven't got the jobs. And I mean, I think that's not only problematic in relation to race, but in relation to disability as well, because all of a sudden it sort of widens the scope of what it is that employers regard as a disability. And I'm talking about that in the social sense, as a social construction, rather than as a medical model. And lots more people get caught in that trap of being seen as too risky to employ, and it being too expensive for the employers to make reasonable adjustments. And in some ways, the discussion about reasonable adjustments and the discussion about risk assessments are very similar ones, right? About what people's needs are, what you can do to mitigate problems in those situations, and what actions and arrangements can be put in place. So I think it's, things like the traffic light system are extremely problematic because they focus on the individual rather than the institution and the workplace and the way that work is organised. And I think, especially given the situation that we've got with the government saying they're not going to extend the furlough scheme, that potentially is going to be very problematic and very discriminatory. I mean, I think both for black workers, but I also see it probably having a big impact when it comes to disabled workers as well.
Yeah, thanks, Wilf. And as I said, we will be getting Quinn back next week to talk about this and the broader issues with COVID-19 and disabled workers. But did you want to add anything else, Quinn, to the risk assessment argument or issue?
I think Wilf has really covered it incredibly well. But what I would say is that we know we are in a recession. It's going to go on for a while. And all the research points to, and the analysis from the last recession, is that disabled people are the first to be made redundant and the last to be employed. And so I'll touch more upon this next week, but I do want anyone who's listening to this to think, okay, how do we protect our disabled workers from redundancy? How do we make sure that they aren't the first out the door? And again, Wilf touched upon the job retention scheme, and we've done a lot of work here to try and get it extended. But we also know that there are large people with sort of who are clinically vulnerable, so who cannot work from home, but who cannot return to work, whose jobs are going to be at risk. So we need to really be marshalling our forces to kind of address that.
Yeah, thanks, Quinn, and we'll look forward to hearing more from you next week. Yes, Ian has posted the link to the registration page for that. So if you want to find out more, please do register. Okay, I think we've probably got time for one more question before I ask Wilf and Quinn to sum up and give us their top tips for workplace reps. So the last question we've had is from Elizabeth. Elizabeth asks, how are we dealing with the safety risk regarding Black Lives Matter and perhaps people's changed behaviour towards Black people in the workplace as a result of this? Wilf, do you want to go with that one?
Yeah. I mean, one of the things that I mentioned when I gave my introduction was about the guidance on them. One of the things that I put in there was actually that as part of the risk assessments, that employers should be clear about what arrangements they've got in place to deal with racial abuse and racial attacks in the workplace. That they need to put warnings in place to deter racist attacks on Black staff and racist abuse, and they need to follow through. And it's, irrespective of COVID, it's been a problem, and then just COVID highlights this. I mean, I always remember talking to one of the reps on Eurostar who was saying that, unlike with London Underground, Eurostar absolutely refused to put up notices saying that, if people abused their Black staff and staff in general, that they would take legal action against them. The result of that is that Black staff used to get physically attacked in the ticket offices at Eurostar. We have to insist that employers don't just say we've got a policy of zero tolerance on racism in the workplace, but actually they make it explicitly clear to customers or users of services that actually, if people do that, there will be consequences, and those consequences will be unpleasant for people, because it's not just a matter of appealing to people's better nature. In order to change people's behaviour, there has to be a consequence if they don't behave in the way that you want them to do. And this is about real commitment from the employers about saying more than, we've got a problem, Black Lives Matter, and we've got this nice policy. We know all these issues have been around forever and a day. But actually, a lot of the basic issues that we're talking about here in relation to, the health and safety and welfare of employers, especially Black workers, have always been a problem in terms of getting employers to take those things seriously. And I think I'll come back to the message I said earlier. But if we're going to get them to take it seriously, we have to organise people in the workplace, not just Black workers, but everybody, to make them understand that actually, if you allow employers actually to leave some people in a dangerous situation, eventually that results in everybody being in a dangerous situation.
Thanks so much, Wilf. Some really great advice there. So the time has sped by and we've had, I think, a really fantastic webinar. It's great to be back after the summer break, and we've had some great advice and tips from Quinn and from Wilf. And there's been some really fantastic exchange of ideas and resources in the chat panel. So you can return to this page even after we finish the broadcast to look up any links that you might have missed. So I'm just going to ask both our speakers just to give us their top tip for workplace reps before we go in their work over the coming months, with particular focus on the issues we've been discussing today. So Quinn?
Top tips, I think, are to listen to your LGBT plus members and be an ally. I think Ian posted a really good link earlier, which is about being a trans ally, but I think the lessons learned in there are applicable to the full LGBT community. It doesn't take a lot to be an ally and to challenge homophobia, transphobia, biphobia when you see it. And to give just a very practical tip, a lot of people worry if someone transitions in the workplace. The one piece of good advice my trans members have given me is that if you make a mistake with their name or their pronouns, don't make a big deal, apologize and move on.
Thanks, Quinn. And Wilf, your top tip?
Well, I suppose I started on a bit of a trade union movement where I was taught that actually an important part of trade union rep's job was not just negotiating paying conditions, but actually, working with colleagues to control what actually went on in the workplace, because we know how the workplace runs much better than the employers do. So, in this situation, I think in terms of making a real difference to people's experience, we have to remember that. We have to be ambitious for them, and we have to encourage people to be ambitious. But in doing that, we have to be clear about the problems we're raising, but not only clear about the problems, but clear about what it is that we're trying to achieve. And to put forward positive solutions to the problems that we identify, rather than saying to employers, this is a problem that you need to solve. Have an answer to that problem. Because actually, if you don't, then you're always, actually only having a conversation on terms of what the employer's agenda is in the workplace. And I suppose, in that respect, that even applies to stuff around risk assessments that we've been talking about today. A risk, as I said, risk assessments aren't just about assessing the risk, but we have to have a clear idea about what the risks are to our members, and we also have to have a clear idea about what solutions we see to those problems, and then organise around that and push the employers to agree to our solutions. Because ultimately, and we always, my experience has always taught me that when you negotiate with the employers around anything, what they will always want to do is the minimum and cheapest thing that they can get away with, right? And we should not accept that, right? So, I think that there's a lot of you, have got a lot of experience and are really capable of getting people going. Be ambitious. That's what I'd say. Be ambitious for people because we can really make a difference.
Thanks, Wilf. And yeah, absolutely. Let's remember that we can make a difference in workplaces. So it just leaves me to thank both Wilf and Quinn for joining us. They've been fantastic. Thank you all for tuning in. You've been a great audience and really interactive. Just to remind you, as I've already mentioned, we will be seeing Quinn again next week. To talk about the impact of COVID-19 on disabled workers. He will be joined not by Wilf, but by Sian from his department, who will be talking about the impact of COVID-19 on women workers. So do please join us for that. But before that, there is another webinar that's happening tomorrow. It's called Building Back Better, about how what solutions we can look for post the COVID-19 crisis and the redundancies that are inevitably coming, and how we as workplace reps can help our colleagues in the workplace with those issues. So do sign up for that as well. Thank you, everybody. And there's a link to that webinar that's just gone up in the chat. So please register. See you all again soon, and have a good rest of the week. Bye-bye.